Mr. Henry,
Hello,
how are you
sir.
again?
Good, doctor.
Good, good. This is Henry, my friend. I've done a couple videos in the past. I want to see how his pulse electromagnetic field of force,
Frequency.
frequency, how his pulse electromagnetic frequency works to heal the body. I've seen some videos on his YouTube channel, on his Instagram. That point, I want to see exactly because I love to work with the body, and he does it naturally with the machine. We'll go over that too, how it works. Give me the background, Henry. Actually, how did you start getting the therapy first? What was your thing?
My thing first was massage therapy,
Mm-hmm.
and working with massage therapy, I got into more corrective, complicated conditions like frozen shoulder, frozen hips, and I started studying under a couple of different older therapists that have been traveling doing seminars, and then from there advancing from other techniques that were more emotional based and also energy based.
And even your own personal life, you walk the walk. You do martial arts.
Yes.
You do what kind of martial arts?
I started off Taekwondo. My first black belt was Taekwondo. Then I started.
Yeah.
Then I went from to Filipino martial arts, Filipino Kali, and now continuing on is Jiu-Jitsu for the last since 2011.
You've done all this since 2005-ish. Is that right?
I finished school in 2006.
Good. So it's been 15 plus years.
Yes.
You have enough experience for me to call you an expert.
I mean, if that's what you want to call me.
I know he's a humble guy. He's humble. So let's go over exactly what is PEMF, how does it work? Because I want to understand how it works.
Right. So I get this question a lot, and um, on the basic level, it is a frequency that goes deep into the cell,
Okay.
and it charges up the cells that are missing a positive charge. So our bodies work well around what they call millivolts. A healthy millivolt is around 25 to 20. A not so well is beneath 15, and you're healing at 50. So a magnetic frequency that goes into the body that gives the cell a charge to a point of 50, then it can actually then start to work well, circulate, and then healing can happen. So basically, all we're doing is just jump starting the cell to do its job.
Nice. So you're telling me if a battery is, say, for example, a 9 volt, not a 9 volt battery, a normal battery has a positive negative end, it's missing the negative end, right?
The positive.
Positive end, so you can't close the circuit. So now you have deficiency in millivolts, deficiency in energy in your body, and I call it energy, low voltage. At that point, if you have a lower energy, a lower bodily function, it's worrying about just functioning every day, not repair and healing.
Right.
Good. So you need that extra jump to 50 instead of 24, 25. For your body actually healed, then you can go back to normal because then your body will reset itself.
Exactly. Right.
Man, that's good.
It's awesome. So
I love it.
Yeah. So when I was exposed to this frequency, I had a hip injury that was constant for years, and I had all kinds of therapies done to me.
Nice.
And I still could not get rid of the hip pain. So when I had this administered to me, I was told to wait about 4 days until I could do any kind of heavy extraneous activity or martial art kicking.
Got it.
And so when
4 days.
4 days.
That's it.
So on the fourth day, it was a Friday, and I went to the gym to where they had a punching bag, and I tried the kick that it was called a spinning back hook kick, and basically you spin your leg, you turn around, and your leg goes really high, and it hits the top of the bag, and my right leg kicked like I hadn't kicked since I was 15, and my heart jumped because my body was not used. It was expecting resistance. But instead it had fluidity, so the entire body just like jumped up and lit up, and I was like, wow, this is different. So that's when I went back to the therapist.
So it wasn't just your hip, it helped.
No, I mean, it helps everything. I mean, your emotion, whenever there's restriction in your body or in your life, there's emotional contact to that. And that's also another portion of also because thoughts are frequencies. Thoughts can hurt us as well. So therefore, if I have a positive thought and a positive experience, that's also charging up my body. So it's working on both ends too.
It's amazing. I know you understand it, how the body and mind are connected in a positive or a negative way.
Right.
Exactly.
100%.
So once you get into the energy levels, understand how energy works and how your body is basically a battery
Yes.
and works properly at a certain frequency and or voltage. How does we're talking about voltage, we're talking about energy, talk about millivoltage, about energy. How does frequency go into that component, that variable?
Well, how does frequency help?
How does the right frequency, help get the PEMF to actually work properly?
Oh, so when it's at basically the setting is already set.
Got it. Okay.
The machine's already come user friendly.
Got it.
It's already user. I don't have to dial in anything.
Cool.
It's user friendly. It's just all I dial in is just intensity and the pulse of the machine. The machine doesn't. I don't have a dial it in knob for the machine.
Okay.
So that's really nice for me. It's kind of like a Mac in comparison to a PC.
I was such a PC guy for so long because I was stuck. It has to be better. And all of a sudden I got Mac. I'm like, why is it so easy?
It's super user friendly. And that's why people that use PC, you love to like build and tinker around.
If you're good if that's what you want to do.
Right.
I just want to pull my files up.
I just want to work.
Email, that's it.
I just want to work. I want to get and do. And
viruses.
So my understanding of the frequency as a provider. So this the way I provide or administer the frequency is different from 99.9% of PEMF machines out there.
Got it. Okay.
Which are so typically what you have is your TENS, you have your STEM, you have different frequency machines that have been out there for a while, and they're all either pads, wands.
Way to conduct it through to the body.
Right, to the body.
Okay.
Without having to use, hands-on treatment.
Got it. Okay.
I allow myself to become part of the frequency to understand energetically within myself where I need to move or where I need to place the frequency most. Not only through my physical touch, because tissue can feel differently through my touch, but also through my internal understanding of my intuition, and that's a feeling. My experience, my gut.
Yeah.
And certain areas will feel like, oh, that feels wrong. There's something there, and then we can also talk about. Then we go back into the thought process of, hey, is there something going on? Maybe whatever it is, this area here is holding a lot of stress. I'll use a very general term because it's not about talk therapy. It's about knowing that stress is relative to physical or emotional.
Well, and my thing to clarify, because I may be wrong, are we saying that the emotion can hide in part of the person's body, an emotion that may cause stress, such as a negative emotion, anxiety, feeling an accident or PTSD, something in the body can hold that, and everyone's body's different, so everyone's body can hold that certain causing a condition.
Right, causing condition, and then and also causing, which is one of the things that PEMF has been listed as supporting, is depression. And if depression is depleting us because of our mind, our thoughts, and which affects our limbic, our feelings, and our feelings are 100% connected to our tissues, then all I'm doing is giving positivity to the body. The second part, of course, is the mindset, but it'll be supported by feeling good. If we're feeling good, it's a little bit easier to have a better mindset anyways.
You almost have, if your default is a certain way and that's your normal, your body doesn't know what difference is.
Right.
So giving it, hey, let's go over here because now here's a better, healthier thing for your body, and it has time to gravitate and default over time to here because your body's so used to that anxiety, that depression, that stress level.
Right.
When you change it over time to a better state, so it becomes your default, it's hard to go back to that old.
Right.
I love you, Henry.
Love you too.
You know your stuff, man. You know your stuff. Love it. Yes. So go on.
Okay. So I guess what I'll go into is how I started using this and the conditions that I've worked with. So I started using this in 2018. About the same maybe a few months after I experienced the treatment in 2017. So after 2017, I reached out to the creator, Simon Billingham, in Scottsdale, Arizona, and I was going to drive out to Scottsdale, Arizona, but then I found that there was another practitioner in Bellflower, in California, and her name was Dr. Michelle Lim, and I went to her, and from there we connected, and Dr. Billingham asked me why I wanted the machine. He wasn't willing to just allow me to just purchase it.
You're just not going to get it anyway.
No, he wanted to make sure that as a practitioner, I had an understanding and I already had experience with it. So I tried it out on Dr. Michelle. Okay. She let me use it, and I immediately understood how to use it. So because there was no training manual for the treatment. Okay. He's just like, do you have it or do you not? Do you gel or do you not gel? That's pretty much Dr. Billingham's approach.
Right. Or experience to go, hey, this is how it works, connects with your body.
Right.
Not just machine, I'm going to use this and do this.
Yes.
It's not no. It's you have to be part of the machine.
Right. And it's a very advanced, I believe it's more for a person that has a more intuitive or empathetic method of approaching the body or treatment. Like you have a lot of, and I have friends that tried the machine that didn't want to go there.
That's not their personality.
Right.
That's not them.
Right. Whatever. And so that also brings me back to there aren't a lot of practitioners that use the machine. Yeah. If you saw the list, it's not a lot.
No.
So
you have to almost pre-qualify to go, hey, this will work for you because you're the conduit to make this work.
Correct. So when I got approved and I got the machine, the first day I immediately noticed a difference in how I felt after the sessions and how connected I was to myself, understanding what was my feeling and what was the other person's feeling, and being able to differentiate between those aren't my feelings, that's actually their feelings.
There's a little border there.
Right.
Okay.
And the transference. And I think that also I had that understanding more so when I became a parent as well. Like my baby, oh, she's feeling this. Oh, that's not mine, that's hers. And so the conditions that I started to get by just, if you build it, they will come, started to become more complicated. I started I had a case where a gentleman he would sit 7 hours a day next to a ultrasound machine so that his leg wouldn't be amputated.
So it allowed enough circulation,
right,
to allow it to not get better, but just to stay.
Yeah. And it took me about an hour and a half, 2 hours of administering it, and this was in the first 3 months of what I've been using the machine, that he realized he had a significant change in pain.
Wow.
Now, later on, he had the decision that if he wanted to run, he wouldn't be able to run with the amount of bone that he had left in the leg.
Well, in permanent
damage, or amputate. But just for the level of pain, we were able to take him out of pain, and then he had the decision later on of what he wanted to do for his quality of life.
He could make a decision.
Right.
He had an option.
Right. It wasn't like just get rid of it. It was like now I'm feeling okay, but what kind of life do I want to live?
Yeah.
And I think just having that sense of empowerment and control is also good for you, because now it's in my hands. It's not at the whim of I have no other choice.
You've lowered anxiety.
Right.
You've lowered stress level. You've made his quality of life this much better.
Right. And I've had the opportunity to work with people that have had severe strokes. One of my cases was where a gentleman had 3 years of constant vertigo, and he was doing cryo, he was taking supplementation, but constant vertigo. He would get adjustments, and nothing was supporting his tissues. And once I brought the frequency to his cranium, to his face, he has Bell's palsy, and then to the left side of his body, he was able to stop the 3 years of constant vertigo, and actually when I met him, he was in a wheelchair, and then he was able to then start to walk and take himself to the restroom. So the quality of life that I've seen just transform just by administering a frequency therapy that me as the practitioner or the person that is administering it through my hand, finding exactly where the most important points are, instead of just placing the frequency and just walking away. It's pretty amazing. It's pretty amazing, and on top of that, adding in the other therapies that I've done, that I do, having an understanding of more of a game plan to how to mix in the tool, because it is a tool. It's not a fix-all. It doesn't cure anything.
Not a panacea.
No, it's just it's a supportive addition to the lifestyle, just like your modalities as well. Like we can get a big jump start, but moving forward, there has to be a game plan.
Oh, huge. And a lot of it is you're giving someone the hope when their quality of life, if 10 is the best and 0 is you're dead, they're at maybe a 1 or 2.
Right.
You're getting to where now they can make a choice. Okay, now I can start moving more. Now I can start doing more things. Now I feel there's hope. I can do things that's not going to hurt today.
Right.
I'm not going to be dizzy when I get out of bed
today. Yeah, exactly.
I can move without getting assistance.
Exactly.
Phenomenal.
It's great.
You're saving someone being stuck in a permanent nursing home because they can't be independent.
Right.
To dependent. They can't be independent, so now they can be independent.
Right. And I'm very glad that you invited me to talk about this therapy, because I have brought it up to other therapists to be interested in it, and I've gotten some resistance back because it's not so popular yet. It's not popular yet.
I don't want to say. I don't freaking care what people think popular. Does it work?
Right.
And because I know you wouldn't do anything on a whim.
No.
You do it because it worked on you. It worked on the clients, and I've seen the results from your videos. Hey, it does work.
Yes.
I just didn't know how. I'm curious. I'm going to video on this.
Yeah. I mean, it's and the list of things that it supports. It supports even bone health, bone healing, osteoporosis, fibromyalgia, because the system's so fried, the nervous system's so fried. I've seen it calm down anxiety. I've seen it support post operations that have been old surgery sites.
Scar tissue, this is permanent. There's no way it can get better.
I have some of my clients that had a full knee replacement, and already she's just finished up her first marathon, and that was with
faster healing.
Way faster healing, because we're bringing up that cell charge.
You're going to the fundamental of how the body regenerates at the cellular level, intracellular level, to actually get things to jumpstart there, versus a medication that's going to chew from the outside in. You're treating from the inside. I'm even getting deeper. Inside, so that actually regenerates from the inside out, so everything works. So everything grows properly, everything regenerates properly. Then you add in exercise, routine, other therapies to get that other quality of life from a 2, 3 to a 4, 5, 6, 7, 8, 9, 10.
Exactly.
Phenomenal. I feel good just talking about it.
It's cool, man. Well, I'd like to show you.
Let's do it.
So I think the best way would be, we're both going to take off our shoes.
Good.
This is going to be for you. This is the grounding mat here, because I don't know if the area is
I got it. We change the camera.
Of course.
Get a better angle this way. Yeah. You know your stuff, and that's why I go, okay, what the heck is this? How does it work? and how to help people over time get better and stay better.
Yeah, a little more vertical, because I'm going to be working on your arm. Yeah, perfect. Both just take off our shoes.
Socks?
You can keep your socks on. Just shoes.
I'm gonna give you holes in my socks today.
I hope not.
All right. We'll see. We'll find out.
What I'm gonna do is I'm gonna do this side of your body.
Want me to do my short sleeve shirt on? Or?
If you have that, that's great.
I have a plethora of clothing in my thing. So talk about where your clinic is. Tell me about your clinic.
Yeah. So my office is in Claremont, California, 250 West First Street. Been there since 2016. It's mainly me as the practitioner and the owner. I mainly only do hands-on therapy treatments. The facility is not a facility for physical therapy training. I do provide information and coaching for movements. And the main goal of the office is to support people's wellness and healing to be better than they've been. That's why I called it advanced sports and body therapy, because I want people to advance their life. And I work with a lot of sports athletes, and the body is, our main house, our main thing that we own. So that is the office space that I work with, and happy to share that with you guys.
Well, and it has a lot of videos too. To go to his Instagram, what practices are, and the mindset of being in healthcare, not sick care, but healthcare to help people's quality of life improve.
Absolutely.
I've done a lot of research on you, sir.
I know, like walk the walk, man. Gotta walk the walk.
Have to. Okay, what's the plan, my
So
friend?
this right here, this gray mat is a grounding mat, because I believe put both feet there. Okay. And that's just to keep the frequency within your body. Okay. So typically, I'm gonna put this grounding mat here on, or this is the frequency pad. So when I turn on the machine here, this sends out a force field. Okay. And then it's gonna go through me. So we're gonna call this the push.
You're the conduit for
that to work. Right. If we were to change the machine, the pull, we can even change it where you put your foot on this and I pull it. I feel like it would be a better experience, honestly, if we pull it. So let's switch.
Got it. Okay. Whatever you think.
You're gonna put your foot right on that. That's it. Okay. So now I'm gonna put a little oil on your arm.
Excited and scared at the same time.
Yeah, we're gonna be palm up. Okay.
Got it. Palm oil, why? Does it matter?
I typically use a coconut base. Okay. Because nobody has allergy to coconut.
Plus, I like coconut.
Yeah, coconut's nice. So I can tell that the grippers here, little air right there. Little flexors. So I'm bringing this frequency down to a 3, and I'm gonna start with a slow pulse, maybe like a 4.
Why?
So as soon as I touch the body, I can understand that based on how you feel right now, it would be best for us to start slow. Okay. Some people, I don't typically, other practitioners will start right out the gate all the way through.
That's my first time.
And some therapists don't care. They'll just go.
I go.
I'm much more of I want to ease into things.
Thank you.
So what I do is I'm going to keep, so it's already on. You can really feel it. Now I ground myself. Mm-hmm. And now the frequency is coming from you and the machine. So basically what the magnet is, all the frequency is, once I touch you, the frequency wants to become a full unit. But because there's a small space of contact, the entire energy is going there because it wants to bring everything back to whole. Okay. If I bring in my whole hand, you feel less, and now it's going through both of us. And if someone came and touched me with one finger, they feel it, and I feel it in my arm. More. Right. Okay. So, but once I bring it down to the finger, now we're getting down to some jumping. It's a little pulsing. Okay. Now, so I can tell that this area here is a little tired for you. Yeah. And what I feel in my fingers, I can feel the pulse, but it's in my fingertips. It's not what you're feeling, because you're feeling it in your forearm. Mm-hmm. Okay. And we're just charging up this area. But what I'm looking for is the fingers to jump. So I'm gonna
move the camera angle just a little bit down.
Go down.
There you go.
Yeah.
There we go. Yeah, perfect.
Okay. So I'm gonna bring it up to a 4. Okay. I'm bringing it a little faster.
Feeling my wrist now.
Yeah.
Forearm to the wrist. Yeah.
I'm just trying to get those fingers to respond. Any pain?
Nope. Just the vibration.
Yeah. So and sometimes people have a little bit of anxiety because the jumping of the tissues, they're like, I'm not doing that. That's control. Yeah. So my next request would be that you breathe a little bit low in the stomach.
Don't let the fight or flight kick in.
Right. Just stay very sympathetic. Very sympathetic, excuse me.
A little bit in my thumb now.
Good. And so as soon as you start to administer it, where it just starts going deeper. where he's going deeper, 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 the longer we stay in the frequency, the longer I stay giving it to this area, administering to this tissue. And I can already tell that it's starting to feel kind of good, actually.
Yeah, I'm almost going more. The form feels fine. It's just the thumb and part of my index finger starting
Right,
to move
a little bit. So you're starting to notice it, yeah. And we haven't changed anything other than I just increased it just a little while ago. And this tissue here is starting to soften up, meaning that the tissue was tired. And we're going to just increase a little bit more in the speed. We'll see what happens there. There you go. Yeah. So now we're and I only increased. There we go. Now we got a finger to move. And the form is jumping. So the arm is jumping.
It's not me.
And there it is, right there. There's the finger, right there. Is that painful?
No, just it's
weird, right? It's just weird, right?
It's weird.
So now I'm going to ask you to open your hand. You try to keep it open.
Okay.
So now this would be like an ART.
Got it. Okay.
So as I am loosening, you are, or putting pressure on the tissues, you're trying to keep it from contracting. Mm-hmm. And that is going to go against the fibers and help the fibers release.
So you're actually allowing more regeneration by doing it this way, too.
Right. And the alignment of the matrix tissues of the fascia, getting them to just feel safe.
Yes.
Very cool. I'm going to bring it up just a little bit more because I want to have a little bit more response. Ready? There we go. A little bit more. I'll bring up one more.
Let me still keep my hand open?
Yeah, just keep it open. Okay. And it's becoming more challenging to stay open.
Yeah.
And now let's pull the whole wrist backward.
Yeah.
Because you as a practitioner, you probably don't get a lot of work done.
No. It's a one-way street.
I know. I'm the same way. I'm the same way. Now go ahead and relax the hand. And now we can just see how much, like you were resisting quite a bit. So this is the actual amount of jump that I'm gonna get from the frequency. So
weird but relaxing.
Right. Let that go. Good. I'm going to open the hand. Move around. How does that feel?
Better.
Feels nice, huh?
It does. It like relaxes it.
Right.
Even though you're putting a vibration in there, you think it would contract it,
right.
Not relax it.
And then from there, once I feel that it's had enough, then I would go into more of a massage modality type of thing.
More soft tissue release.
Soft tissue release without the frequency.
So what are you feeling when you do it? When you're on there?
So the only thing I feel from the frequency in my fingertips is just the vibration, a little bit of buzz, I would call it. Okay. Sometimes it can be a little uncomfortable for me, only because the client that I'm working with, their tissues are so exhausted that it's resisting the absorption. Yeah. So the energy is going into the path of least resistance, which is me, because I have less resistance, and then it goes back into them. So one of my clients, she had a very severe. This is one of my latest videos. Severe spinal injury.
Her leg, right?
Her legs. She's not able to walk. She's in a wheelchair. Semi control of her right leg, has not had any movement in her left leg, and only pain in her hip that was causing her back.
For how long?
Since the injury, which was 2019. So, and that's also caused, emotional connection to that. Her entire life has changed. Now I bring the frequency to the point of pain in her hip. And that point of pain was so much that I could just feel it traveling all the way up my arm and into my stomach. But the pain was not physical. Yeah. It was emotional. So that's what I experienced.
But
sometimes.
The emotional can still make it feel like physical.
Absolutely. So then I just ask her to breathe with me. Yeah. And then later on, sometimes there may be something that will come up for me, and just having to get that out.
I'm saying, wear you out too.
A little bit.
Okay.
It can be, but only if I'm willing and understanding that I am allowing myself to be in the space to support somebody. So because I'm not ashamed of talking about my faith,
Mm-hmm.
I also pray while I do the work.
Awesome.
Because I understand that I'm not the savior. There's only one savior, and that's not me. So therefore, I ask for support in that space when I pray, and that also allows me to have other understandings about myself that I did not know prior. Like again, why do I do this work? Why do I choose to show up?
Your vocation.
My vocation, exactly. Why am I doing this? I could do anything else, but I'm choosing to be here.
Worth it.
And then at the end, it's like, man, that's amazing.
Worth it.
Of course.
You're helping someone's quality of life improve that. For example, spinal cord injury, wheelchair bound, they can go from as, I want to say, a 1 to maybe a 2, then a 3, then a 4, then a 5.
Right. And then after that session, what comes up? She tells me that for the first time in 3 years, she was able to move that leg on her own with her mind. She moved it by will. It wasn't just a wish anymore. So what's the potential to the future of her progress? If there is progress, how much can we get?
She's seen the change. She has hope.
Right.
And she's gonna ask, "What's the next step, Henry? What else can we do?"
And I'm trying to get her linked up with the main spinal cord injury organization, Be Perfect in Claremont, so that she can, continue.
Now she's able to.
Exactly.
They want a certain, what I know about the foundation, they want a certain type of quality of life first. Right. And then they can work with that.
Exactly.
Without they're like, well, how do I work with someone who has no nerve control anyways?
Exactly.
They can't do anything. It's a physicality to regenerate those nerves from the ground up. You're helping them, those nerves work properly. You're turning them on to allow them now regenerate over time at an accelerated rate.
Exactly. Because by itself, what's 7 years of nerve regeneration by itself?
Yeah, you're going to be dead before she can actually walk.
Exactly.
No. It's time. It's time with hope that you're giving her that faster time and more hope she can do more and more and more for one person.
Exactly.
And not just one person. That's for everybody.
Exactly. And everybody she takes care of, her kids, everybody.
That's awesome.
Yeah.
Well, how does it work the opposite, out of curiosity? If I was to step on the pad and you were to do here.
You want to try?
Yeah. Curious. I'm a curious cat.
Of course. Let's switch. All right.
All right. I want to see this now. I'm like, how many is everything?
I love it. All right. I'll give you a little bit of juice in the hand. Okay. Move it on your hand. Put it on me.
Okay. Sorry.
I didn't pay attention.
That's all right.
It's okay. I'll oil myself up just to give you some. Oil me up, Dak.
There you go.
All right. Cool.
Oiled up.
All right. Now you're gonna want to use one hand only. Okay.
One hand or one finger?
You start with 3. Okay. Now I'm gonna start pretty low so you can just feel. I'm gonna start with a 2, and I'm gonna start with like a 4 pulse. Okay. So make sure you keep keep your fingers on me. Do not take them off because they'll get a little funky. Yeah. Ready? Yep. Put a little more pressure. All right. Now start lightening up that pressure.
Yeah.
But don't disconnect. Now take one finger off.
One finger off?
Yeah, maybe like right there.
Okay.
So start moving it around a little bit.
Yeah, I could see how this could affect you, the clinician.
And we're in a 2, and my finger's already jumping a little bit.
Yeah.
So that.
Yeah, I can feel that.
Yeah, and just breathe through your body, because now you're experiencing what I feel.
Yeah.
You're experiencing me, man.
Wow, it's intense. I want to say this is probably the harder work.
Yeah.
Than it is being the patient.
Yeah. There's a lot of focus.
Yeah. It takes a lot to keep your fingers on there because the pulse is pretty strong.
And we're only at a 2. I was at a 6 on you, man.
Yeah, let's go to a 6, man. Break me into a 6.
Yeah.
Pretty crazy.
I know.
What the heck? So I go one finger, then what happens?
You'll feel it more.
Oh yeah, that's like double. Okay.
Yeah. So it takes it takes a little bit of getting used to of the energy that you're dealing with.
What is contraindicated to being the clinician or the patient? Anything you've done so far?
Nothing. None.
Because it's electricity. It's not going to affect anything in the body negative because it's just electricity.
Right.
Okay. Okay. So heart problems, that wouldn't affect them either.
Only if you have devices like a pacemaker that work off electricity.
Got it. Okay.
Then you're like, no, we can't work with this.
There's too much risk.
And also pregnant women, because you have a whole other bodies being developed that we don't want to mess with that process.
You just don't know.
Right, you just don't know.
You don't know that's going to affect them.
Right.
Because you're affecting the mom, which she'll feel one thing. She'll go, yeah, go higher. And all of a sudden the baby's like, no.
Yeah, exactly.
I'm a smaller being here. Let's not mess with it.
Yes. And I mean, I know, that's crazy, right?
That doesn't, it's uncomfortable.
I know. You want to stop?
Yeah, stop it.
All right.
We're good. I got the feeling. I appreciate it. Oh, yeah.
That tissue paper right there.
Yeah, man, that's crazy. So how long would you do a therapy with somebody?
Depending on the client, and what I feel. So I've gone, I mean, this is kind of crazy. I had a guy one time who's 6'5", and he had a foot that was so clustered in tissue and botched surgery that he wasn't able to run. I did about 2 hours on that foot. But let me tell you, after that 2 hours, that guy ran, lost 100 pounds, and living his life.
What the heck? Change the camera.
Of course.
What the heck? And after one session or how do your sessions work normally? Do you search sessions?
I go a half hour to 2 hours. I've done longer when I take a break in between, and I'm doing other body parts, and they're like, because I'm like a whole.
Back to it.
Right. I don't typically like to do those.
Yeah, it beats you up, man.
It's a long job.
Yeah. Well, physically, it's gonna. I mean, just the pulse alone and just that intensity.
This, to me, I'm used to it. No problem.
Well, I don't think it's. I'm not a candidate, I don't think, for this yet.
But it's something that you could. I mean, if you wanted to. Yeah. And for me, when I started doing energy work prior to this,
exactly, you're already into it.
I was already into it. Yeah. But the energy work, because we have receptors, we can already feel. Like now with this, I can feel. Oh, it's right there. Yeah. Oh, right there. How do you know that? Your body's emitting that frequency.
And now you're more sensitive because now you're in the field.
Even without it.
You're an artist.
Even without that.
You become an artist to understand how your body now is more like you said, more sensitive to what's going on around you.
Right.
Crazy. It works. Sorry, it works.
Yeah.
It works. And with someone that, for example, you mentioned earlier that had spinal cord injury, what type of prognosis do you give them, or what's your first, I guess, assessment with someone like that?
I don't say that I would know how long it would take, but I do make recommendations as far as what I believe would support them moving forward to get the results they're looking for. It may be a homeopathic doctor or a practitioner. It may be a nutritionist. It may be a personal trainer. It may be a chiropractor. It may be a mindset coach, and also start looking at different habits.
It's almost you guide them from a 1 to 2 to 3 to 4 where they can function.
Right.
How do you make that function now progressively get better to
better
quality of life?
Exactly.
With their mindset, their nutrition, their body mechanics, and everything.
And then I even recommend them, like, you might want to look into stem cell treatment. That's in south of the border. Even though the U.S. isn't as popular or allowing as much of it, I've seen great results from people that have taken the time to go out to like Colombia.
They get results.
They get results.
It's not like it has to be FDA.
No.
Everything has to be blah, blah, blah. They get results.
They get results, and that's what I'm like. Is that what you want? Then I recommend you get the ticket.
Talk about too. What do you do in house besides the PEMF? What else do you do?
Everything that I provide, I either coaching with stretches that are going or mobility techniques that are going to be used with maybe resistance bands, some strength techniques and coaching of awareness before they start to do any kind of push or pull or squat, as well as I do also offer a vacuum therapy, which is like cupping, but a much more adjustable setting so that the tissues on the skin are not breaking to create a lot of redness. If there is some, it's not intentional.
Okay.
as well as myofascial techniques, things of that nature.
Physical therapy, body work, soft tissue work, fascia release, things like that also.
Yeah.
He does everything. If anything, if you have a condition that is body related, talk to Henry at that point, get a consult, because in my mind, he has the experience to help guide you either with his therapy or someone else that can get you to a better state of health.
Absolutely.
Anything else I didn't cover I missed today, Henry? Because I usually miss something.
I think we covered pretty much everything that I wanted to cover.
Any questions?
No.
Thanks you guys for watching. Again, Henry's information is on the post from today, and also put it on Facebook, Instagram, everywhere else too. Even the podcast later on too. He's in Claremont. I'm in Upland. He's down the street. Go ahead and see him. Talk to him on the phone. At that point, get his information. Just talk to him. Will help you feel relaxed. That's right thing. All right. Thank you, sir. Quick picture for the video.
Yes, sir.
And we're good to go. Thanks for coming in.
Dude, thank you, man.
Oh my gosh, so much easier.